I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Okay, I have to say sorry to you guys because I wasn't able to do a live video yesterday and last night because we had a training. It went quite late to 9:30, and I have other stuff to do. And then after that, one of my colleagues called me and we discussed some case study to help our patient at night time. So I didn't manage to do a live video, but I was actually want to do this one last night to share with you guys about my win of yesterday. So one of my patients came from Wellington. This is about 6-hour drive. 6-7 hour drive, keep it longer if you stop somewhere. Yeah. And then she actually suffered from AMD. What is AMD? AMD is age-related macular degeneration. So, so she came back. She came to Hamilton, from Wellington to Hamilton. They received acupuncture treatment. Now, if you suffer from macular degeneration, you know that there is no cure in Western world. In the Western medicine, there is no cure, right? And they actually have two type of different AMD. One is dry one is wet one. With wet one, a lot of people get injection. You may get 6 injections into your eyes, right? In a year. And I've seen that people got every 6 weeks, which is more than 6 times a year. Now, with dry one, there's not much solution for you. All right? Either it's dry one or wet one, AMD. Acupuncture is a great solution for it. Now, we're not promising to fix or cure it, okay? So, but what we're gonna do with acupuncture and Chinese medicines. So, number one goal that we want to do is preventing this disease, AMD, to get worse. This is number one goal we want to do. So, our treatment is try to do prevent. It's a prevention treatment. So prevent AMD to go worse. That's number one. Number two, if it doesn't go worse, we wanted to maintain that as well as improving, okay? Improve your vision, improve the curve that you see, that, and improve the discomfort when you read. You can't read properly. Okay, we want to improve those things. All right. Now, for what happened is with this patient, all right, she got worse in the last year, coming up the last year, and her vision it got worse fast, very fast, and she also have headache and migraine ever since she was 2 or 3 years old. So what does it indicate? It indicates that the blood flow to the head are very bad. She had at least 3 headaches weekly, at least 3, right? This is a major one, right? So how do we actually measure this patient's progress? Right? One thing is we want to measure how the eye test. We put it somewhere about 2.5 meters away. So test the eyes, one in the others. So before acupuncture, we test it. Of course, we need to OCT examination as well, but we don't have the OCT examination in here. So I asked her to get a OCT examination before acupuncture, and after acupuncture she's going to get another one back to the same clinic. Now, left eye was the worst. Cover one eye, just look at the left eye, and she couldn't see this. Even the big E, she couldn't see it. She can't name it out. She can't see it. That's okay, which means the left eye is the worst. The right eye is better. The right eye, she can read this and level 2 as well. She can read level 2. That's not too bad. But she couldn't read level 3 at all. Okay? Couldn't. Now, after 10 acupuncture, well, if it's out of town, if it's not in Hamilton, we get the patient come in twice daily for acupuncture. If it's you live in Hamilton, you can drive in. We want to see you 2 acupuncture or 3 acupuncture weekly. After 10 acupuncture, we measure the progress. Now, she reached 10 acupuncture yesterday. So we did a test again, another test. Unfortunately, her left eye, no progress. She couldn't see any of that. But good news is left eye and right eye. Right eye, so you can read here, here, and all level 3, you see? That's the progress after 10 acupuncture. Then she can read all those things, but she missed this one. She said it's P, it's actually D, you see? So we want how this is the right one. She can read to here. So that's great. What are both eyes? With a bit of left eye help, she can read actually level 4. But before the acupuncture, right eye is a level 2, both eyes together level 2. But after acupuncture, right eye level 3, left eye, both eyes level 4. There's a big progress. So again, this is just one of the cases that we treat and what I share with you. Now, I'm not guarantee that it will definitely help you, but there's a hope. There's always hope, right? Not until you try it, then we test it out whether it helps or not. For this case, while acupuncture help eyes disease is one of our main focus in our clinic, right? So apparently we are the only clinic using acupuncture to treat eyes problem in New Zealand. So if you are in New Zealand, or if you know anyone that have AMD or any eyes problem disorder, contact us. Our phone number is 078467956, and we will help you. With acupuncture, it helps, but we don't just do acupuncture for you. We actually show you how to do acupressure point around the eyes, what sort of technique that you should do, right? You perform it every day, twice daily, to get the blood flow to your eyes. And do some acupressure point over here. Those are very good for eyes. Then some distal point in here that for your eyes. So those things, a combination treatment for AMD. It's not just one treatment. It's not just one type of method, one tool, one solution. We get all together to help you, and as well as Chinese herbs. This patient back to Wellington today. She's taking Chinese medicine as well for a month, and after a month, she's going to do her own test and see whether she can see better or not. Now, great thing is with this case, we have another measurement. What measurement is that? Now, I mentioned that she had headache every week, at least 3 times. At least 3 times. She need to take medication for it. Right? She need to take painkiller for it. While the treatment, about weeks of treatment, then she told me that she only had 2 headache. Hey, 2 headache, and it's very little one. One of the headaches she need to take half pill. It was 2 pill not just half pill. Now, what does it mean? It means all the acupuncture treatment and the acupressure treatment and actually help increase the blood flow to the head, so that we decrease the headaches. And when the blood flow come to the head, which means more blood flow to the eyes, and that actually help AMD to heal, to prevent AMD to go worse. And based on that, we go a bit further to make AMD better, improve it. Right. So yeah, that's it. I hope that this sharing with you and actually encouraged you, that let you know that it's actually there is a hope for AMD patient. If you don't treat it, hey, you're gonna get blind in the end, right? So you don't want to go there, and there's a hope for with acupuncture treatment. So call us 078467956, and we're happy to see you, and we're happy to help you, and we're happy to organize that if you're from out of the town, and call us and we can talk, and I can show you the acupressure point, and I can show you, even if you're not coming here for treatment yet, you're managing that. I can film a video and show you how to do the acupressure point, and you can do the acupressure point back at your home. Start with that, and when there's available time of you, then you can come in for acupuncture and Chinese medicine treatment. Right? Stay awesome, and I love you all, and I'll see you tomorrow. Thank you very much. Bye bye.